It's my turn to welcome you all on our webinar on health solidarity challenges. I think there's no better time to start than today to talk about this. First and foremost, I have as the moderator the task to give some housekeeping rules. We will have question and answer sessions directly after Audrey Tang's talk, my talk, and Ambassador Law's talk. So please be prepared to either ask in person with video or in the chat function. It's possible. The second housekeeping is we're going to register this. So if you don't want to be online visible, just ask your questions in the chat. And now I have to say that it is like Nicole Sue said it, we are co-organizing this webinar today. We, that means the Institute of Global Health of the University of Geneva and the Taipei Cultural and Economic Delegation in Geneva. We are happy to do so because we know that global health is both academic, political, economic, and we need all the expertise. And to introduce one of our organizing institutions, I ask Professor Stephanie Dagrand to say the introduction remarks. Stephanie Dagrand is a professor at the Institute of Global Health Medical Faculty, but she also is a professor of law at our law faculty. Stephanie, welcome. The floor is yours.
Thank you very much, Bettina, for this introduction. Dear guests, dear participants, I welcome you all in the name of our Institute of Global Health at the University of Geneva. The Institute was founded in 2014, quite a new institute, and is the result of a strong commitment to global health and the deep conviction of the importance of academic research in this field. The members of the Institute have been particularly active during the pandemic and contributed through their work to a better understanding of the issues at stake. The Institute is particularly well equipped to address global health challenges. It adopts an interdisciplinary approach combining different methods and perspectives. We have a research group on global health epidemiology, led by the director of the Institute, Professor Antoine Flahault. We are also conducting research on NCDs prevention, infectious diseases, and mathematical modeling, human, animal, and environmental health, humanitarian public health, as well as policies and governance in global health. I, for myself, conduct research on global health law and health and human rights. And this explains why I'm particularly interested in the subjects that will be discussed today. The role of international organizations in the development and implementation of new rules for a better preparation of states and for a better global answer to new health threats is at the very center of the discussions conducted at the moment at the global level, within WHO, of course, but also within the World Trade Organization and other multilateral organizations that are implicated in the definition of a solidarian response. Another challenge is, of course, the implication of all the stakeholders, and in particular, the civil society, in the definition of this solidarian response to future pandemic. The opportunities offered by the use of technical technologies will be discussed, and I'm very free to have the opportunity to learn more today about the experience of Taiwan. The use of digital technology seems to be considered a central element in Taiwan to improve democracy. On the contrary, in Europe, we are more suspicious about digital-led responses and possibly the misuse by our governments or third-party actors of such technology. It's a great honor for me to open the discussions, and I give the floor now to my colleague, Professor Bettina Borisch. You're muted, Bettina.
Thank you so much, Stephanie. And now over to Nicole Su, Director General of the Taipei Cultural and Economic Delegation in Geneva, the other or host organization of today's webinar. Nicole, yours is the floor.
Thank you, Professor Borisch, and thank you, Professor Dagron, for opening today's session. It is indeed a great pleasure for my office to organize this webinar together with the Institute of Global Health of the University of Geneva. It has been 2 years and COVID-19 pandemic is still affecting the lives of many people around the world. Relatively speaking, situation in Taiwan has been well contained. Though there are measures such as quarantine and contact tracing, there has never been any lockdown. This is possible due to the harsh lessons we learned on our own from the SARS outbreak in 2003 in Taiwan. This is why we understand perhaps more than anyone the importance of solidarity and that we should work jointly to tackle these challenges together. Indeed, no one can fight the pandemic alone. As early as December in 2019, Taiwan's disease surveillance system was one of the earliest, the first agencies which detected signals of pneumonia of unknown origin in China and immediately reported it to the World Health Organization. During the past years, we initiated rounds of campaigning of international humanitarian assistance globally and actively sharing our experiences. And we did witness the virtuous cycle of other countries helping Taiwan when we had challenges for the procurement of vaccines last year. The prolonged course of this pandemic demonstrates the importance of solidarity, especially knowledge and experience sharing. Can we utilize digital technologies such as smartphone apps, web-based tools, and other information technologies to develop innovative anti-pandemic measures? Yes, we can. In Taiwan, we integrate them with our national health insurance database to facilitate the process of antigen and PCR testing, contact tracing, and the registration for vaccination, and so on. While applying these digital measures and promoting public messaging, how do we make sure that we do not infringe the privacy and civil rights of the individuals? And fundamentally, can we maintain the freedom of speech and movement and the trust between people and government of our society? Yes, I believe we can. In Taiwan, we've managed through policy transparency, public dialogues, and media literacy, and most importantly, in a democratic manner. However, while we are all trying very hard to end the pandemic, have we really tried hard enough to promote solidarity? Have we taken all the measures we can so that we can learn and share the knowledge and experiences with one another, with all members of the global community? I'm afraid that there are still challenges. So I'm very happy today that our speakers today will share with us their views on these challenges and perhaps solutions to these questions. I look forward to the discussion today. Thank you. Back to you, Professor Borisch.
Thank you, Nicole Su. And as you talked about the challenges and the cases for real solidarity throughout COVID, one, I think, of the cases that was very important for solidarity or for non-existing solidarity was a question of vaccines, both production, testing, distribution. And so I am very glad to give two, let's say, examples of innovation and sharing of information that come from the Americas. The first one will be from Paraguay, and this will be a message from Professor Osmar Manuel Cuenca Torres. He is the Dean of the Faculty of Medical Sciences at the University of Asunción in Paraguay. Please let us listen to his message about vaccine during COVID. I have no voice. Let's start over again. Perhaps even if it's a Spanish voice, I like to listen to real voices. And we will listen by looking at the subtitles.
Buenos días, soy el doctor Omar Cuenca Torres, decano de la Facultad de Ciencias Médicas. En nuestra institución se ha llevado a cabo un ensayo clínico de fase 3 para valorar la tolerabilidad, seguridad e inmunogenicidad de la vacuna desarrollada por el laboratorio UNIGE COV-1901 en comparación con la vacuna AstraZeneca en pacientes adultos mayores a 18 años de edad. Se trata de un estudio aleatorizado, a doble ciego, con control activo de 2 brazos, multicéntrico, realizado en la Facultad de Ciencias Médicas y en la Fundación Taipei. La plataforma utilizada por esta vacuna es una subunidad proteica de la proteína modificada S2P relacionada a la proteína Spike de la SARS-CoV-2. Los estudios preliminares de este ensayo clínico han demostrado que la misma produce una respuesta inmune robusta a pacientes que la han recibido, motivo que ha llevado a su declaración como uso de emergencia por nuestro ente regulador, la DINAVISA, siguiendo las normas internacionales de las guías de la Organización Mundial de la Salud. Los pacientes seleccionados fueron sometidos a un seguimiento riguroso luego de cada intervención a través de un control de monitoreo continuo que ha fiscalizado la ocurrencia de probables efectos en los pacientes que han recibido la vacuna. No se han realizado hallazgos de efectos adversos graves, solamente efectos locales leves relacionados al sitio de la aplicación de la vacuna, fiebre, somnolencia, fatiga, lo que ha demostrado que la seguridad en los pacientes ha sido óptima. Es de gran importancia para nuestro país la realización de este tipo de estudios porque permiten dar una visibilidad científica a nivel local e internacional a nuestra institución en un país en donde no se invierte mucho en investigación. La Facultad de Ciencias Médicas ha realizado una alianza estratégica en el laboratorio UNIGE para la realización de este proyecto que ha permitido su financiación, transferencia tecnológica, recursos y sobre todo el fortalecimiento de nuestros recursos humanos de manera que pueda llevarse con seguridad futuros estudios científicos de esta naturaleza. Muchas gracias.
So, we thank Professor Torres, an example of a transnational collaboration both on scientific innovation and creativity and academic science. From a small country like Paraguay, with probably a good output also on its population, because trials run in your own country make you feel that this is probably well tested. So if we talk about innovation, I will give over and hand over to Mr. Stephen Konya. He is senior advisor to the innovation part of the Department of Health and Human Services in the US, and I think he is best placed to talk about innovation and health information technology. Thank you for being with us, Mr. Konya.
Thank you very much, Bettina, for allowing me to participate. Good afternoon. My name is Stefan Konya, and I serve as the Senior Advisor and Innovation Portfolio Lead for the Office of the National Coordinator for Health IT at the U.S. Department of Health and Human Services. First, I would like to begin with sincere thanks to our colleagues from Taiwan for convening this gathering of policymakers and thinkers to discuss digital health, a topic that has always been very important, but is particularly relevant now as we witness in real time the power of innovation and digitalization to respond to and recover from the COVID-19 pandemic. In many ways, the pandemic has forced us to leap forward in terms of technology development and adoption, particularly with respect to health-related digital technologies. And to that end, it is important to note that the United States recognizes that Taiwan is able and willing to help the world on the COVID-19 and other public health challenges beyond the pandemic. We appreciate Taiwan's focus on health cooperation and technical assistance to demonstrate its value in global public health. We commend Taiwan's successful control of COVID-19, as well as sharing of your experience domestically and to the global community. Next, I'd like to talk a little bit about the U.S. response and commitment to supporting digital health innovation. The United States is prioritizing digital health and innovation by strengthening our efforts both domestically and globally. Please allow me to highlight just a sample of the key investments and initiatives we've launched since the pandemic began. Last June, the U.S. Department of Health and Human Services committed $80 million specifically to the strengthening of public health information technology to improve COVID-19 data collection, address chronic health and socioeconomic disparities that the COVID-19 pandemic exacerbated, and to ensure that our healthcare system is better prepared for the next public health emergency. This year, the White House Office of Science and Technology Policy launched the Community Connected Health Initiative, which explores and pursues government actions and policies that help ensure communities do not get left behind as the rapid innovations in health technologies continue to transform the U.S. healthcare and social service landscape. Next, I'd like to talk about the power of partnerships. Central to the success of all these collective actions to support greater innovation in digital health will be the ability to leverage the power of working together. Partnerships across our federal agencies, partnerships with other nations throughout the globe, and whenever possible, partnerships with key non-governmental and private sector stakeholders. In an effort to support promising startups that are working to provide solutions to address these needs, the United States, through the Department of Health and Human Services, recently kicked off the Pandemic X Accelerator. As a prime example of multi-agency collaboration, this new initiative is co-led by 7 federal agencies under the Department of Health and Human Services, the private sector, and many others. These startups are getting access to curriculum, mentorship, resources, and other collaborations to help scale their business and work towards creating solutions that can reduce, or hopefully even one day, eliminate disparities and inequalities. Pandemic X has also been a great place to discover new opportunities for how to improve the way the United States government can support innovation in the marketplace. When it comes to global partnerships, the U.S. has also joined our multilateral partners in pushing ahead with digital health while simultaneously tackling the associated challenges such as interoperability, data sharing, and digital literacy at a global level. The U.S. was among the 14 founding members of the Global Digital Health Partnership, a dynamic collaboration of countries, territories, and international organizations working together to advance global digital health, with the main focus areas being cybersecurity, interoperability, evidence and evaluation, policy environments, and clinical and consumer engagements. Now, having grown to a membership of 33 nations and 3 international organizations, GDHP is the world's largest intergovernmental and multilateral platform on digital health. And with the United States now serving as the GDHP chair, we are excited to announce the relaunch of its website, www.gdhp.health. And I highly recommend all of you visit it for more information. In conclusion, digital health and innovation continue to be increasingly critical components of a strong healthcare infrastructure beyond COVID-19, and the incorporation of digital health has already helped immensely to strengthen national, regional, and global health systems. We must continue to foster the digital health ecosystem needed to maximize this potential through consistent funding, investing in a strong scientific workforce, and by leveraging each other's strengths through partnerships towards attaining long-term digital transformation success. Thank you.
Thank you, Stephen, Konya, for this. Thank you very much also for reminding us of the fact that kind of COVID catalyzed a lot of things that have been there around, but as I listen to you, have been really pushed forward through, with, and throughout the pandemic. Thank you so much. And I think these two examples show us what's going on now with the pandemic. And it is for me now almost too complicated to introduce Audrey Tang. Why? Audrey Tang, I've met her, I'm following her, I'm listening to her. I really could say I'm a fan, but why did I start to be a fan? She is not only the digital minister in Taiwan, but she also thinks very broadly about topics that concern us all, that concern us and our way we could or should or will be living together. Audrey Tang is here with us to talk about digital social innovation. And I think we will all be listening very, very interested. As I said at the beginning, Audrey Tang will have to leave rather quickly after having given her talk. So have your questions ready for the question and answer Q&A session that will follow, or put them in the chat so that we can interact with Audrey as long as she is there. Now, Audrey, really it is yours. The floor is yours, and digital social innovation is on the plate.
Thank you. Really happy to be here virtually to share with you some of the social innovations on solidarity that we have witnessed in the past 2 and more years during the pandemic that enabled Taiwan to counter the pandemic without a single day of lockdown in a jurisdiction with 23 million people, still at less than 900 people dead of COVID. And we also fought the infodemic, the disinformation crisis, without any administrative takedown. So this no lockdown, no takedown playbook is what I would like to share with you. Now, there are 3 pillars, and I will illustrate with very short anecdotes about social innovation, and that's fast, fair, and fun. That enable us to crowdsource ideas from people, collective intelligence, as early as 2019. What you're looking at is PTT, sometimes called the Reddit of Taiwan, but it's not like Reddit in that PTT doesn't have shareholders or advertisers. It's open source, co-governed for more than 2 decades, squarely in the civic sector, right? The civic sector's infrastructure for people to focus their conversations instead of on polarization or fake engagement or attention-seeking advertisements and so on. So when Dr. Li Wenliang's message came to PTT at the last day of 2019 through this No More Pipe, this young doctor, people very quickly triaged this news and found out it's probably legit, and it allowed us to start health inspection for all flight passengers coming in from Wuhan to Taiwan on the very next day. But of course, it's not limited to people who frequent those text-based chat rooms or bulletin boards. Anyone can pick up the phone and call this toll-free number 1922 to share as part of the collective intelligence their response to the counter-pandemic values and policies. And on the daily 2 p.m. press conference the next day, as you can see here, the health officers led by Minister Chen Shizhong will answer those highest resonating ideas. For example, in 2020 April, there was a young boy called 1922 saying, "You're rationing out masks, but all I got was pink ones, and all the boys in my class have blue mask. I don't want to wear pink to school, and I don't want to wear mask anymore." And so the very next day, everyone wore pink at the press conference. And I think Minister Chen said Pink Panther was his childhood hero. And so the boy now has the color of the heroes, and heroes. And every fashion brand turned pink for a couple of weeks. And that made mask from something that showed obedience into something that showed self-expression. You can wear rainbow mask and so on, which no doubt helped on the initial counter pandemic efforts. But more interestingly, we relied on the civil society to co-create digital services where the state cannot, for example, show people in an accessible way immediately where to find those masks. It's the G0V or GovZero movement that stepped into the rescue. You see, G0V is, again, a civil society staple for more than a decade that look at all the digital services that the state does as something that GOV.TW, but turn the O to a zero. And so just by changing the O to a zero, getting the shadow government that implements open source fork of the official service, but always with interactivity, transparency on the algorithm and also on the data. So instead of the state having to take care of all the information needs, we have more than 100 different tools that display the real-time inventory so that when people queue in line using their universal health card, IC card to purchase the rationed mask in early 2020, well, they can just refresh the phone and in 30 seconds, they will see immediately the inventory of the nearby pharmacies and ensuring that we distribute them in a fair way. As I speak, the same bunch of people in GovZero are working on using the same system to show rapid antigen testing availability on masks and so on pharmacies. So it is a reusable infrastructure, again, in the social sector, not government technology, but rather civic technology. And also allowed independent analysis from OpenStreetMap community, many other communities on the fair distribution. So initially we thought, oh, the pharmacies overlay exactly with population census. So each person on average is of the same distance on the available map on the masks, but they show that it's not the case because not everyone owns a helicopter. So the same distance on the map doesn't translate to the same opportunity cost in time. And that allowed us to rapidly change the distribution mechanism, introduce pre-registration, again, 24 hours after this is raised through an interpellation. So it turns protests or it turns opposition party into co-creation because they have exactly the same data that we have, we publish upon collection. Now, finally, around the infodemic, we chose a way to, instead of taking down anything, to repackage the science discoveries and the latest policy, for example, physical distancing, proper mask use, and so on, into Creative Commons remixable ideas. So we call it humor over rumor, essentially out-miming the conspiracy theories. For example, this very cute spokesdoc shows you that when you're indoor, keep 2 Shibas away, outdoor, indoor 3 Shibas away, outdoor 2 Shibas away, or wear a mask to protect your own face against your own unwashed hands, and so on. And people remix those messages. They're very cute and got into the kind of poster spokesdoc in many communities. And in contact tracing, we also, working with GovZero, discovered that for many people, installing an extra app takes time. But existing Bluetooth-based contact tracing exposure notification system require a critical mass of millions of people, actually 8 million people or more, in order to function well. But how do we make sure that people can still register for contact tracing before we reach this critical mass? Well, we discovered that people's smartphone have a built-in QR code scanner and a built-in SMS sensor. So if we post this, allow people to self-print those random codes on the venue door, and people just scan and then hit send. They don't have to install anything, and it still counts as registering. And there's no smartphone required because you can manually test those 15 digits into 1922, again, a toll-free number. And so to provide accountability, the GovZero people also made sure that the 15-digit random number is not known by the telecom company as mapping to a venue. And the venue never learns your telephone number. So only the official contact tracing people can piece together those puzzles. And every of those piecing together leaves a trail. So people can go to this website, enter their phone number, and see in the past 4 weeks who exactly have looked at their records and why. And so this ensures that the original intent of data collection is used properly. Of course, everything is deleted after 28 days. As of this week, we're phasing out this system because we finally hit the critical mass of the Bluetooth installation, but it provided a very important shortening of contact tracing from more than 24 hours to less than 24 minutes that help us to successfully eliminate Alpha, Delta, and the first wave of Omicron. So in short, what we have done is leveraging our existing existing infrastructure on universal healthcare, but supporting fully the civil society's open innovation, open source innovation on the affordable information and mask and nowadays rapid testing, so that we fight communication diseases without a top-down, lockdown, take-down, shutdown thing, but rather to work the norms together with the people, not just for the people. And now if I have another couple minutes, I would like to introduce some infrastructure that enabled this kind of co-creation to happen. Dr. Tsai Ing-wen said in her inauguration speech in 2016 that democracy used to be a showdown between two opposing values, but we need to now think democracy as a conversation between many diverse values. That is to say, from showdown into co-creation. So as digital minister in charge of social innovation, this is my office, by the way, is an open park. Anyone can come here and have 40 minutes of my time during Wednesdays to talk about anything related to social innovation. And it's through this way that many local innovations, for example, this is the airbox that started in the southern part of Taiwan, where the PM 2.5 level of pollution is slightly higher, as you can see here. And many young children in the primary school want to learn about data stewardship through airboxes. That is the very inexpensive boxes that measure those air quality in their balcony, in their school, and that report to the district ledger so they can inform their parents whether they want to walk on the morning or the PM 2.5 is high, so they should stay indoors. And then through turning this into a digital infrastructure, we reward 5 ideas every year through the presidential hackathon. So ideas like this, after testing on a local level for a couple months, 5 of them get this trophy every year. And the trophy carry a microprojector that when turned on shows the president giving you the trophy. So it's self-describing, promising whatever you did in the past 3 months will get the financial, budgetary, personnel, regulatory support to scale that into national level. And so this allows us to rapidly build data collaboratives after pilot testing it on a small town or a small city and so on. And through this nationwide electronic voting called quadratic voting to review the synergies between one SDG target and the other, and finally culminating in the 5 ideas every year turned into public infrastructure. And so we tour around Taiwan and we listen to people's local social innovation ideas, and we bring virtually all the different ministries in the central government so that we can build open innovation test pilots, proof of concept called sandboxes that test the viability. And when we're ready to scale it to national level, we also use assistive intelligence to power people's thoughts, feelings about those emerging technologies. After presenting facts of, for example, Uber in 2015, driving in a couple of cities, we asked the entire country, how do you feel about Uber or UberX? And those ideas that has the highest resonance are turned into the important part of a diversified taxi regulation. So instead of debating on abstract things, people just click agree on each other's points and they move toward them, disagree or move farther away from them, but there's no reply button, so there's no effort to grow. And every time we have this good enough consensus that we then turn into working regulation for emerging technologies and develop those key measures of success together. And that's what enabled the social solidarity before the pandemic to be turned into this rapid co-creation that enabled the pandemic responses to happen. So that is my opening remark, and I look forward to the questions and answers.
Thank you so much. Thank you so much for both the examples of COVID and the examples of how you collect information of citizens and how you come to consensus in a country like Switzerland, where the consensus is very high up on the agenda. We look at this with interest. I would like to open up for questions, and I think that my colleague Stephanie Dagron would probably have a question because she is working on the legal aspects of digital technologies, especially in health. Stephanie.
Yes, thank you very much, and thank you for this presentation. That's fascinating. Actually, you answered, as I listened to you, you answered to my first question, which was, how do you make sure that the population is involved in the definition of the solution you have adopted? So you have already answered to that. I was wondering, you know, as the pandemic started, we all, or nobody knew what is the best solution to adopt. So we didn't have the scientific evidence telling us, well, you know, if we gather data, we will be able to use this data and attain the goal we have adopted. How did you, you know, I guess you proposed solutions to the population, but I have a difficulty with that point. How can you be sure that this is a solution that is the one solution that is to be adopted in order to counter the propagation?
Yeah, this is an excellent question. Thank you. Our solution are really just prototypes. And whenever the civil society, that's to say people closer to the pain, think of a better way, then in 24 hours, our CECC, the Central Epidemic Command Center, will come out and say, oh, we pivoted. And then this newer idea actually works better, and let's use this new idea. So I think this is about increasing the bandwidth of democracy, not just through representatives or votes or referendum that takes place every year or so every couple of years, but rather it's about a high bandwidth democracy where people show their local prototypes and just test it out using the same data as the state-run solutions. And so this enables a shorter iteration so that when it provably generates better outcome, the state can simply say, oh, because it's open source, let's just use that as the canonical, as the approved way of doing things, at least until the day after tomorrow, in which actually we may iterate again.
If I don't see someone from, do we have, no hands raised, I dare to abuse my function as a chair to ask, in times, and I follow up with Stephanie's question, in times of uncertainty, we are always in times of uncertainty, by the way, but how would you use your system with general citizens in Taiwan? How would you go around in a global format?
That's an excellent question. From what I understand, because the open source community knows no boundaries, as soon as something like the mask rationing map happens, people in especially nearby jurisdictions take notice. For example, people in Seoul in South Korea just email their city government and say Taiwan is doing this. Why couldn't we do the same thing? And there's no reason why they could not, right? If they publish the availability in the same API, the programming interface, we actually can build the tools without actually dedicating those tools to any particular jurisdiction. So one of the first mask rationing map that takes place in South Korea was actually from Tainan City, from Taiwan. And the author, Finjan Kyung, doesn't speak Korean, but he speaks JavaScript, I guess, and that's enough, right? So this is the kind of common infrastructure that goes through at this commoning process because of our shared urgency. I personally also contributed to the translation of the dashboard of the Tokyo metropolitan area simply because they decided to build it not with a contractor, but on the open on GitHub. So I contributed a translation, and not as a minister, not through our foreign service, but rather just as another contributor on GitHub. And so this borderless collaboration, at least among democratic alliance networks, I think that enable a different kind of infrastructure building that we should actually do more during the non-emergency times, so that during emergency times, we already know, oh, this component from that will probably help.
I have seen, thank you, Audrey. I've seen a question that looks like a follow-up question in the chat, comes from Tang Taiwan, says the application of software and narrowing different positions is very interesting. I am thinking how this idea could be applied in the World Trade Organization to reach consensus in multilateral negotiation. It would be very appreciated if Minister Tang could answer.
It is free software, and it's already part of our public infrastructure. So if you search for Polis or go to polis.tw or polis.gov.tw, you can start such an open conversation almost immediately. So try it out, just as simple as you can launch a Google survey form. This is a wiki survey in which that the survey items are not sourced by the survey writer, but rather by the survey participant. This is a crowdsourced survey. So I would encourage you to try it out on something that is maybe not essential or critical, but rather on, I don't know, what kind of lunch are we going to have together tomorrow? That's always a very good starter. Something like that, and then get familiar with the limitations of that platform. And then furthermore, I think there's a lot of case studies on the Polis website that showed on the various different scales. I would suggest maybe start with around hundreds of participants. That's the scale where it really shines, but it can be designed to scale to thousands, tens of thousands, or hundreds of thousands.
Okay, so if I get you right, Audrey, you think that even people at the World Trade Organization or other UN organizations could be using it for consensus creation. Very, very, very interesting. We'll see at the next meetings. I think that the specialist on innovation in the US is also, I know the US also looks very much at biosecurity and security issues. Turning to you, Stephen Konya, what would be your question to Audrey concerning the security aspects?
Thank you. Audrey, wonderful presentation. Thank you very much for that. And I love this concept of participatory citizen science, getting your citizens involved in government. Really appreciate that. In the US, we've got a couple initiatives where we work closely with the private sector to advance innovation in the space of biosecurity. Just curious how you're working on that in partnership with your private sector, specifically for biosecurity.
Yeah, definitely. I think a lot of it is on the sharing of the monitoring data and the kind of sharing that empowers this kind of contact tracing is already built on the shared infrastructures that is co-created by the private sector. So I think a lot of this is general purpose, in the sense that we prototype a specific use of it, in this case on contact tracing. But if people want to use exactly the same thing, but on ensuring of the safe transmission of any material and so on to its destination, or a crowdsourced monitoring on things that may have biosecurity risks and so on, like photographing a alien species and things like that, and automatically correlating that into crowdsourced reporting and so on. I believe that the Council of Agriculture in the previous presidential hackathons have actually proposed and implemented exactly this. So what I'm trying to say is that if we build public infrastructures as general purpose and open enough, then people who want to build such applications then can rely on the cybersecurity parameters of the underlying infrastructure without having to do too much of the penetration testing and things like this. We did test that before, and they just focus on thinking of the application, and that enabled people who are not professional developers to nevertheless propose their own innovations on this regard.
Thank you. Thank you. And I see that my colleague Professor Stephanie Dagrand is coming with another question, if you allow, Audrey.
Sure.
Stephanie, please.
Yes, thank you. I have a question regarding the use of data, of private data, of medical data, and the protection of the individuals. As I said before, in Europe, we are more critical regarding the use of data, just because, I mean, you seem to tell us that the technology is actually quite secure, but you must know that data, private data, have been used in the past in order to have been used to increase discrimination on minority groups. And that's a real issue. I would like to know if there are difficulties, how you address these difficulties. And as my colleague said, having a global use of this technology might be difficult, because you really need to make sure that you are living in a democracy respecting human rights and privacy in order to do that.
Yes, excellent question. I think one of the main ideas is that during the pandemic, we do not invent things that did not exist before the pandemic and mandate people to use that technology. That is to say, we appropriate technology so that it fits the norm expectation of people, but we never ask the people to adapt to technologies. And this is very important. Now, for example, on contact tracing, everyone feels safe on different matters. For example, I know how Bluetooth works, and I've looked at the specification of the exposure notification built by Apple and Google. So I understand that it is privacy preserving to a degree. But on the other hand, last year, I don't think many feel secure on the Bluetooth enabled contact tracing, because it didn't exist before the pandemic. And so people go to SMS-based contact tracing exactly because everyone knows how SMS works. And after showing that really the venue really knows nothing about your phone number, and your phone telecom company already knows your phone number anyway, but they don't know how those 15 digits map to any specific venues. So technically, it's called oblivious federated storage, but people don't have to know that jargon, right? People very intuitively understood how it works. But like my grandma, she never really takes any phone, flip phone or smartphone out, and she's almost 90 years old. And then she can still just write her contact on a slip of paper, and on the convenience store, just put it into like a voting box, so people queuing after her cannot see what she has written on it. And that still counts as a successful registration. And so peaceful coexistence of many different norms allow people to choose the one that they feel the most secure. And that is what digitalization to me means. It's about enabling people to collaboratively learn about new digital stewardship and data stewardship. This is not about training machine learning or machine training so that people have to feed their data into machine learning algorithms. It's not like that.
Thank you. Thank you very much, Audrey. I'm looking around the round table, and I don't see anyone else raising its hand or his or her hand.
I think
So in this,
Kay is raising their hand.
Please. Okay, come.
Hi,
Yes,
hi, I'm not sure if this is working. I'm using my,
yes.
I actually just downloaded a software to use my phone as the camera, so
Works.
I don't know if it's working right now.
Yes,
Hi,
we can
yes,
hear
my
you
name is
fine.
Kay Marcus. Thanks for this sharing. This is extremely interesting. And I have a question also about data, because I'm currently developing a mobile app myself to allow, following the COVID pandemic, to allow people to exchange items with one another, and like just things that you have and something that other people need. So I'm just also wondering, in terms of this data, so first, how do you, so you're talking about how the way that you set up your system is that you can allow users of all types, even those who are not used to, let's call them 21st century technologies. I was wondering, can you dig a little bit further about that, how you deal with this population, the elderly, for example? And so that's the first question. And the second question is, again, I'm also thinking back on this chunk of data that you have. It's a wealth of it. And with the rise of using big data in real time for scientific purposes, what can you do with this wealth of data that you have accumulated through this contact tracing movement?
Thank you. Both really good questions. The first thing, I'll just share an anecdote of 20th century technology. So when the people pointed out that rationing through pharmacy isn't fair to people who live in places where they don't own a helicopter and have to take hours to get into what looks like a small distance away on the map, we introduced immediately pre-registration so that they can collect on nearby convenience stores. And initially, we thought it's a good idea to use the ATM, the teller machines in the convenience stores so that people can insert their debit card and then wire a small negligible amount of money and then authenticate themselves and also pay for the mask and then use that slip of paper to collect. However, my grandma, almost 90 years old, said that her younger friends have a very different take, and her younger friends is 77 years old. So Grandma Yang actually walked with me to the convenience store as part of a focus group and said that she will never use the ATM because to her, the ATM is just to withdrawing cash. If she wants to wire something out, she always go to the post office or a bank and write a slip of paper so she can be sure of it. So she said, if you insist that I enter my debit card password, I will go back to the pharmacy and curse the government. And so we changed that immediately so that the kiosk in the convenience store instead read the universal health card and require no password, and she can count in coins this negligible amount of money, just a couple euros, to buy for 2 weeks of rationing of mask, and she is happy. So what looks 21st century is actually not the best. But if you involve the people who are closest to the suffering, to the co-creation process, their wisdom actually leads to find solutions that work for them and not just for them. She told all her younger friends of 66 years old and 55 years old, and that massively increased the adoption of the mask pre-registration mechanism. So I hope that answers your question. It's not us designing for them, it's us designing with them. So this with, not for, again, is important. And the second thing is that for contact tracing, we don't use that for any other purpose, period. I think a crime investigator tried to issue a search warrant to get a mapping table between the 15 digits and the venues because they're investigating some crime. And not just the judge denied the warrant. The judge actually went public, whistleblowing, saying that the ministry really need to say that we should not allow it for any other purpose whatsoever because the GovZero, the civil society, designed it with a clear warning that says this is for pandemic control only. And so we did that interpretation, unlike nearby jurisdiction who say for serious crimes you can use it, or for really, really important research you can use it. We simply say it's designed with a specific purpose. It's deleted after 4 weeks. So it's just for that purpose. I believe this is what allowed us to migrate to a Bluetooth-based norm, which exactly worked the same, except it's not the telecom companies, it's the Bluetooth in your phone during the erasure.
Thank
I hope that
you.
answers your question.
I think did this answer your question? I hope so. Thank you very much. Thank you for your presentation. Thank you also for being available with us for question and answers. If there is no urgent question around, I check again. I check with Ali, then I would say thank you to you. Goodbye to you in Taipei. And again, we will listen to all the other developments and innovations that are co-created with the population of Taiwan. Thank you very much, Audrey.
Thank you. Thank you. Live long and prosper. Bye. Ciao.
Thank you. Bye. This is now probably really difficult because I have to introduce myself. As you have heard, my name is Bettina Borisch. I'm a professor of public health at the Institute of Global Health, University of Geneva. I am a medical person, studied medicine and modern history, and I am also a basic science in the sense that I am trained as a pathologist, but came to human sciences on and moved from pathology, from the microscopic view of health to global health, to the real global view on health. And that is why I would like to exchange some of my thoughts about health and society change now. I think that during the last 2 years, we heard the term crisis at frequent intervals. It was for sure the health crisis of COVID-19, but also health crisis or security crisis. This term crisis itself leads some people to think of a short-term event with a clear-cut beginning and a clear-cut end. Some even use the word back to normal, back to before COVID. You may have heard it. But let me tell you, this is an illusion. Why? Even without a pandemic, we can never go back, not as an individual person in our lives, and not as a society, not as a given society. This ignores that we are changing, and with us, society is changing. The examples of changes that we experienced only in the last 2 years are numerous. Think of work and life, of home offices, of mobility, of energy questions, of family life. But if you take a step back, how many changes have happened during already our generation? Like recognition, better recognition of minorities. Sometimes this takes very long. I always say that it took 100 years for Switzerland to introduce the vote for women, but now it's part of society. And if we think and always talk about crisis, I think we have to move to another paradigm, a paradigm of continuous work on complex situations. And we should not think that we will solve one problem after the other, one crisis after the other. As we change, we need to adapt. And we also need to adapt our, what we call social contract regularly. How to adapt the social contract, the way we decide to live together to a changing and challenging world. Well, the best but very difficult way is, I think, the democratic way. A lot of changes happen quite fast these days. So how can we listen to people and collect their views fast, quickly? We will, I think, adapt our democracies, the way we take into account public opinion. And given the pace of changes, we will need transformational infrastructures, structures that adapt but also induce and help favor change. We heard just right now from Audrey Tang a social innovation using digital technology. And this is something that in Taiwan helps the democratic process. Indeed, if we think that in democratic countries, we sometimes have elections only every 4 or 5 years, this is quite selective and not very close to the motions, emotions, and thoughts of people. So I think the innovation that we have heard today could be tested in other places. Indeed, if we do so many things digitally, our democratic system with voting ballots and punch cards looks a little bit outdated. I am working on global health, as you know, and we all know well that we only can live in good health all together. Or using the words of Dr. Tedros, no one is safe until everyone is safe. So we need to act globally. Can we find innovations for global citizenship, for global governance? This is a question that I'm working on since quite a certain time. And if you do so, you come across the principle of solidarity. What is solidarity? A kind of altruism, a kind of charity? Partly, there may be points. Is solidarity inborn? Do we have a gene of solidarity? Again, it is like solidarity is like with health. Solidarity can only be with others together. But if we say others, this will mean with people different from you. And this implies to bridge the gap between differences, real differences. We see these days solidarity with people close to us, we know with family, with friends, people who are like us. Even our social systems in countries where our social systems are constructed on nation states. So for us, but not for the others. In this situation, is a global solidarity possible? Is transnational solidarity imaginable? I think yes. But what would be the ways to reach out to a global solidarity? What has been shown is that if you really ask people and listen to them seriously, we will always find out that we all have worldwide far more commonalities than differences. The basic wishes of humans for what they want in life are surprisingly similar wherever you are in the world. For example, people want to live peaceful, healthy lives with family and friends. One example. But their wishes are frequently ignored or not respected. But would we have ways to put forward our commonalities and discover that they are more important than our differences? This would be the first and important step. What would be the ways and means of doing so? Do we need a global social innovation? Or do we have already institutions like, for example, the UN system? And yes, we need equity. If we talk about solidarity, equity, that all people from countries and places have access not only to the bare necessities of life, to the global common goods, but that they also have access to respect, dignity, and to the fact that we respect their voices. Thank you very much. I think that I don't know if you want to react to my thoughts. They are in link with the wish to come to a global solidarity. And I don't know if someone of you would like to raise hands or to intervene. I'm turning around and perhaps I see, yeah, please, Nicole.
Yes, Professor Borisch, I find it a very inspiring the questions that you ask. Indeed, people, indeed, the idea that you mentioned, that solidarity meaning working with others, which means that there are others, that we're not all, in a way that there are individualities among people, and then I think indeed the most important thing is that we may aspire for similar things, or even saying things as happiness and so on and so forth, and basic rights of being healthy and so on. But then, yes, there are differences. And the most important thing is that how do we, exactly as you put it, I like it very much. How do we achieve that goal with respect? that there are differences and we respect each other for their differences, and also try to find what is common in among us as perhaps being human beings. So that is firstly, I think very important that we recognize that there are differences, and then we could realize that we need to sit down and talk, and then to communicate properly and express ourselves. And during the conversation, we respect each other and try to find what is common, and then how to reach our similar aspiration for being happy, for being healthy, and so on. That I think, or even though they may sound like simple ideas, but then from time to time, people do forget that, and then try to focus only and solely on oneself too much, that we forget a lot of times that there are other people who may have differences, different ideas, and then we forget to respect others. So I love your presentation in a way that it is important to remind again and again that we need to respect, and then to recognize the difference and respect each other. Thank you.
Thank you, Nicole. And I think the difficulty, and that's where we're working on, is how we can get that on a political level. How can we share this internationally? And as you may know, there is now a lot of discussion around a different form of foreign policy, what some people call feminist foreign policy, that more respect of the other and less power play, and less exclusion but inclusion. And I think that this discussion around new forms of foreign policy may be one of the ways to go forward also internationally, because it is something that hinders us. And in some places now we have wars and things that really are unimaginable if we sit here around the table. So I think we also need to get this into the political debate, and especially into foreign policy. This is probably a task we do have, a task that we around this table here could take up and take it further, perhaps. If I don't see anyone else wanting to come in, but perhaps at the end we have possibilities to freely exchange ideas, I think it's for me a very, very good moment to say, because I said foreign policy, I mentioned UN organizations, I said, is the UN system ways or means to get to this global solidarity, to this global innovation, global citizenship? It's my pleasure to ask Dr. Chang-Fa to give us his talk. Dr. Chang-Fa is the permanent representative of Taiwan to the World Trade Organization, and he wants to talk to us from health-related to health-centric, a desirable changing role for the World Trade Organization in its response to international health crisis. And I'm very happy to give you the floor, Dr. Lo. The floor is yours.
Thank you very much, Bettina. Let me also thank the organizers for bringing up a fundamental issue of health solidarity, which is explained a moment ago by Bettina in an in-depth manner, and which I thought to be the key concept to address the most challenging issues caused by the COVID-19 pandemic. My discussion is on the WTO's role in international health matters. This is about solidarity at the international level. My focus will not be limited to the COVID-19 vaccine issues, but also more broadly on the WTO's role in the global governance for global health crisis. Let me start with briefly explaining the current negotiations under the WTO and then ask ourselves to step back a little bit to see what has been going on in the WTO decision-making process and to identify what good and bad experiences the WTO has gained in addressing the international health crisis. Based on these experiences, we might want to outline what we can expect from the WTO in contributing to the international collaborative effort to address the current pandemic and the future crisis of similar nature. The WTO is basically an economic organization established to promote trade liberalization to help countries gaining economic interest. It is understandable that negotiators representing their respective countries are addressing all WTO-related matters from the perspective of self-centric trade benefit. They always look at the issues from the perspective of maximizing their economic gains and minimizing their economic losses. When negotiators are calculating gains and losses, they could probably ignore the public goods emphasized in the WTO agreement, which should also guide the overall operation of this multilateral trading system. Among these common goods, the protection of human life and health is most emphasized in the WTO. In many WTO agreements, such as the GATT, the GATS, the TBT, a lot of acronyms, SPS and government procurement agreement, the protection of human life and health is explicitly provided either as the general principle or as the legitimate objective or as the basis of justifying trade measures. In the TRIPS agreement, the protection of public health is even cited as the basis for WTO members to formulate their IP laws and regulations. Also, very importantly, in some WTO dispute settlement cases, the protection of human life and health is considered as the highest human value to be in the whole operation of the WTO. For instance, in the famous case of EC asbestos, the appellate body says the objective of pursued by the measure is the preservation of human life and health, and the value of which pursued by the responding party is both vital and important in the highest degree. Also, in another very famous case of Brazil tiles, in which I have the honor to serve as a panelist, the panel report says that the objective of protecting human health and life against life-threatening diseases, such as dengue fever and malaria, is both vital and important in the highest degree. So having understood the WTO connection to the protection of life and health, let's briefly see what have been going on in the WTO concerning its handling of the COVID-19 pandemic. Just yesterday, the WTO DG, Dr. Ngozi, along with the chair of 12th Ministerial Conference and the General Council chair, issued a joint invitation letter for the rescheduled 12th WTO Ministerial Conference. In the letter, they mentioned that the uneven and fragile recovery from the COVID-19 pandemic have had important implications for vulnerable populations around the world. It is therefore not business as usual. The letter also indicates that ensuring that the trading system makes its full contribution to responding to this and future pandemic is an important problem of the global commons that remain on the WTO agenda. This is the most updated perspective of the multilateral trading system toward the COVID-19 pandemic. No one would deny that the COVID-19 pandemic is a challenge to the WTO, that the WTO cannot do business as usual at this critical time, and that the WTO should have a role to play in making its contribution to respond to the current and future pandemic. However, when it comes to the exact ways of ensuring the WTO's contribution to address the pandemic, members have very diverse perspectives. There are two parallel but interlinked negotiations going on at the WTO with regard to the COVID-19 pandemic. One is the discussion of TRIPS waiver under the TRIPS Council. The other one is the discussion of the WTO response to the pandemic under the General Council. Let me very briefly explain the situation. On the TRIPS waiver issue, that was started from October 2020 when India and South Africa submitted a TRIPS waiver request, in which they proposed that a number of TRIPS provisions, including patent, industrial design, trade secret, and copyright, should be suspended during the pandemic for everything related to the pandemic, including not only vaccines, but also health products and technologies. The proponent argued that the protection of IP rights, such as patent protection under the TRIPS agreement, creates barriers to ramping up the production and to the access to this product. The opponent considered waiving IP would not help ramping up production. Instead, voluntary licensing is the solution. It took almost 1.5 years for the main proponents and opponents to come to a potential compromise last week. The main content of the potential compromise text from the news report are that it covers only patents for COVID-19 vaccine. It will waive off certain compulsory licensing conditions, but does not cover IPs related to diagnostic and therapeutics. It does not cover other IP protections such as copyright and industrial designs. So it seems that the compromise text is still encounter domestic difficulties in some of these 4 members. But if we look back, there were actually common grounds that we can easily identify in the beginning from the respective positions of the proponent and opponent of the TRIPS waiver proposal. Actually, the proponents seek to waive a wider range of TRIPS requirements, whereas the opponent seeks to offer a little more flexibility for compulsory licensing of patented right. They use different languages, i.e. waiver versus flexibility, but they are not different by their respective nature. They are different only by their respective extent. The common basis for discussion is obvious. There is a flexibility that is wider than what the opponent offered, or a waiver that is narrower than what the proponent requested. This is reflected in the above mentioned agreement or potential agreement in the news reports. It is unfortunate that it took more than 1.5 years to find this for the main players to find this commonality to move on. Let's turn to the multilateral response to COVID-19 pandemic. The WTO has been working on formulating a holistic approach to address the issue. Some members focus more on combating the pandemic. Some others consider that mitigating and recovering from the impact of pandemic are also important. Some intend to set forth higher ambition in the document. Some others prefer to include only certain general principles and to leave substantive issues being discussed under future framework. Some focus on addressing the current pandemic. Some others suggest having a framework for the preparedness of future crises of similar scale or nature. So up to now, the discussions of the WTO response to the pandemic comes to stagnation, serious stagnation. The fundamental problems are whether to have higher or lower ambition and whether to use the facilitator's text as the starting point or to even restart all over again the whole discussions. Again, the common grounds are obvious. We all agree that we are talking about saving lives and protecting health. The WTO is most relevant to addressing the COVID-19 pandemic, and we need to do something for the protection of life and health. But the differences are basically whether the WTO should do more or less at this stage. However, members just cannot agree on the extent that we can jointly carry out at this stage and on the things to be included in the program for future discussions. My comment is not to blame any particular member or any group of members for the stagnation. My concern is that we all lose our sight and ignore identifying the commonalities that can be easily identified for us to work on. Turning back to the premises of this talk, that is the WTO being a very important component of the global health governance, let me point out a very positive development. In 2018, the Dispute Settlement Panel of the WTO issued a report on the Australia tobacco packaging requirement. In the report, the panel found that the Australia's tobacco plan packaging measures are not inconsistent with the WTO, especially not inconsistent with the Agreement on Technical Barriers to Trade. Throughout the whole report, the panel consistently cited or quoted the Framework Convention on Tobacco Control, that is the FCTC, and quoted some guidelines adopted under the FCTC to support the justification of Australia's adoption of tobacco plan packaging requirement. This is indeed a very positive development, showing that the FCTC has already been a very important factor to affect the interpretation and the operation of the WTO agreement to address issues relating to public health issues. The FCTC can make the WTO more friendly and even supportive to stricter tobacco control policies. To briefly conclude, any international system, any international legal system across the world should place the highest value on human life and health. The WTO should be of no exception of placing such value as the core element for the multilateral trade system. There are three ways to ensure that the protection of life and health maintains as the core element of the WTO. First, the negotiation function. Negotiation function is an important way to achieve this. When negotiators come to negotiating life-saving and health-protecting issues, bearing in mind the highest value of this organization and bearing good faith in identifying commonalities are the key to ensure that the WTO can contribute. Second, the dispute settlement function. It is another way to achieve the higher protection of life and health. From what I've just quoted, the tobacco plan packaging case, we have reasons to be optimistic that the protection of human life and health, or more generally, the protection of public health, can be ensured through WTO dispute settlement functions. And certainly, the inter-organizational collaboration between the WTO and other international organizations is yet another very important way to contribute to the global governance of public health and to the protection of human health and life. In this regard, I'm hoping that in the future discussions of the possible treaty on pandemic prevention, preparedness, and response under the WHO, the members of the WTO collectively will be able to make their contribution in perfecting the trade and economic aspect of the treaty. We are facing many new challenges. Negotiators must bear the common goods in mind when dealing with life and health issues. The trade negotiation mode perhaps should be changed or switched to a life-saving mode to identify common grounds to work on. Otherwise, the WTO will have no role to play in this critical issue of international concern, and could become irrelevant in this rapidly changing world. Thank you, Chair. Thank you, Bettina.
Thank you very much. Thank you so much. It is indeed very high on the international agenda in Geneva around now the pandemic treaty negotiation, but also the questions that you alluded to, how do the different UN organizations work together? Because the pandemic treaty or pandemic convention for sure will be broader than WHO and will reach out to World Trade Organization issues. And how will that work? We do not yet know, I think, but it's good. And thank you for hearing from you about the waiver question, about the issues. And finally, closing on a positive note, thank you. Are there questions? Is there anyone who wants to ask directly a question I saw that Professor Dagron was taking notes all along through your talk. I think the lawyers among themselves, big one.
Yes, I can come in if you want. Can you hear me?
And not so well. Speak up a bit and then probably better.
Okay, okay.
Yes,
Can you hear me now?
Perfect.
Okay. Okay, thank you so much for this presentation. I would like to know your position on, you know, what could be a possible solution to be adopted by the member states, WHO member states, in the new negotiations regarding access to what has been called in the economic words global public goods. Could you imagine a disposition in this new pandemic treaty authorizing, you know, common development and distribution to everyone of the medical solutions that could be invented? What I see and what you have explained regarding the waiver and the flexibilities that exist with regard to intellectual property rights is that, you know, there are some rules, and actually, and that might be a second question, actually WTO does not play a huge role in practice. What I mean is you have the possibility for states to use flexibilities and to develop generica, ignoring the patent rules. But in practice, these flexibilities are really difficult to use for different economic and political reasons. So I find it quite hypocritical from countries and the EU to say, well, you know, we don't need a waiver because we have this flexibility. And actually, WTO is not really taking part or taking a position regarding these questions. That's the way I see it. I might be completely wrong. And I would love to hear you on this point. Oh, you are still muted.
Thank you for the reminder. Thank you very much, Stephanie, for the questions. They are excellent questions, and perhaps some different point might help the discussions, not necessarily for the current debate, but for future negotiations or discussions on the possible new treaty or convention. On the flexibility issue, let me put it this way. Currently, there is the provision in the TRIPS agreement, which is, most of you understand well, the agreement to protect intellectual property rights, including to protect patent. In Article 31 of the TRIPS agreement, there are flexibilities, as you mentioned, available for developing countries to issue compulsory licensing for the domestic generic producers to use the patented invention. The difference, well, the debate or the discussions at the WTO perhaps ignored the fact that actually, if we are able to allow more flexibilities under TRIPS 31, Article 31, perhaps we can achieve the goal that a lot of members expect to have, that is to allow those developing countries which are technologically capable of producing vaccines being able to produce that. The point is that Article 31 is about the requirement, and currently the requirement, some of the requirements are being waived under the 2001 Doha Ministerial Declaration on TRIPS. Actually, if we can expect countries to agree on waiving almost all and every requirement under Article 31, plus some additional provisions that might be able to allow those countries to produce vaccines. The result would be the same as, or would be similar to the result arising from the TRIPS waiver proposal. For instance, some countries says, well, because I do not have a domestic legal regime to allow authorization, compulsory authorization, therefore Article 31 would be a hindrance for us to conduct compulsory licensing. Well, if that is the situation, as I mentioned, we can add a little more element to make it work. For instance, we waive Article 31 requirement, plus we considered an authorization has been issued. Therefore, there is no need to conduct domestic legal procedure for the purpose of issuing compulsory licensing. This is a bit technical, legally technical, but the point is that if we focus on the problems, and we focus on the current provisions that create the problems, we might be able to find the solutions, not necessarily using the term of flexibility or TRIPS waiver. Just focus on the issues. On your first topic, I thought that these two parallel discussions. One is under the WHO, the other one is under the WTO. Of course, can be pushed forward without considering the development of other the discussions in other forums. But I thought, based on what I've explained, when it comes to the WTO to negotiate new either declaration or decision or agreement or any instrument, people start to calculate benefits and losses. It turned out to be very difficult nowadays to negotiate any new treaties. But taking the lesson that we learned from the tobacco plain packaging case, we understand that if there is a new instrument being negotiated in another forum, the WTO will respect them, in its operation, especially in its dispute settlement system. So if that is the situation, that the WHO is able to conclude a treaty on the preparedness and prevention of COVID-19 and a similar pandemic, and if such treaty or convention include some trade-related provisions, for instance, some kind of waiver, some kind of trade measures, some kind of domestic support or financial support to the vulnerable groups. These all are trade-related, being governed by the respective WTO agreement, subsidies agreement, in other agreements. But if there are some rules there, of course, the rules must still be containing some requirement, reasonable requirement. If there are rules there based on scientific principles or evidence, then the WTO will respect it. That could be a way forward. So this is what I've just mentioned about inter-organizational coordination for the global governance of public health matters. Thank you.
Thank you very much. And thank you for pointing out that this inter-UN respect and respecting other UN organizations works, and probably some important information for us who we are into the pandemic treaty work now. Thank you so much. It is really, unfortunately, the time for me to conclude, but I would like to thank, first of all, our co-organizers, yes, first and foremost, behind the scenes, there are people from the Taipei Cultural and Economic Delegation in Geneva who are helping this all happening. Thanks to them. Thanks to those you see here on the screen, Nicole, Stephanie, the two co-hosts, the speakers, Audrey, who had already to leave, Dr. Law, and our colleague, Dr. Konya from the US, and our colleague from Paraguay, whom we had in a video format, but also to you, those who were listening. Thank you for being with us, and I hope you take the knowledge and the information and the thoughts with you. We are there with you to work further. If you have inputs or queries, please come back to us. You will find our, well, on the digital world, you will find us, and you can come back to all of us with questions, innovations. We need the innovations. Thank you so much to everyone. I give for the last words to Nicole Su to conclude today's meeting.
Thank you, Professor Borisch. We again also thank you, all of you, for your participation, and we look forward to reach our goal of global health solidarity by working together, by respecting each other. Thank you so much.
Thank you, everyone.
Thank you.
Worldwide.
Thank you.
Goodbye.
Bye-bye.
Good morning.
Goodbye.
Good evening. Bye.
Bye. Thank you.